Well, good evening and welcome to About the Valley. We are taping, this is not live, so there'll be no phone calls taken. But I have 4 ladies with me here who all are in the business of, you might say, final care?
Healthcare.
Healthcare.
Mhm.
But in the later years.
Later, yes, for the senior population.
Well, there are some young people that end up
Mhm.
too, and
Mhm.
you know, you get come down with a bad illness and you can end up in a nursing home.
Right, or
At a
home
young
care, or
age.
hospice, you have a
Or
PD
hospice.
program, right.
But I'm not gonna introduce you individually because it'll take too long. We only got an hour.
Sure.
And I think we got a lot of things to cover.
Cover.
But we're gonna open up with with home care, right?
We're gonna talk about home care. So my name is Lynne Alexandrowicz, and I'm a consultant in the healthcare industry, and I consult for Accessible Home Care, which is a private home care agency, female-owned and co-owned by an RN, by a registered nurse, and we're located in Auburn, Mass, and we service the marketplace. So I'm going to talk a little bit about home care, and we're going to talk about the PACE, what a PACE program is. We're going to talk about assisted living. We're going to talk about nursing home care, and we're going to end the conversation with hospice.
Which is your final care.
Right. Mm-hmm.
But home care is I'm very interested because I'm up there
Right.
and you never know what. And no one wants to really go into a nursing home.
Mm-hmm.
But sometimes you have no choice. But now
Right.
home care is becoming more and more popular, isn't
It
it?
is. I was actually at an event this morning in Marlboro. It was a senior networking group that is made up of healthcare people. There were probably about 60 people in attendance. There were 18 home care agencies there this morning represented.
Wow.
Yeah.
It's a growing business.
It is. So there's 2 different forms of home care. So there's one that is paid by insurance, which is called Medicare Certified Agency. So your V&As of the world, that is pretty much Medicare covers your coverage for your services. And then the other side of home care is the private sector, which means private funds, no insurance, except maybe long-term care if you were able to get
Right.
long-term care insurance. So we'll start off with the Medicare Certified Agency. So, let's say you fall in the snow this Saturday, because we're getting snow, Harry said, and you break your hip, and you end up in the hospital and have surgery and what have you, and then they're going to send you home versus
Right.
send you anywhere else. You're going to go home. And then they said, we're going to bring the V&A in, or we're going to bring a Medicare certified home care agency in. The insurance will cover that. You have to be at your home at all times to receive Medicare insurance on home care. You can't have physical therapy come to your house and then they leave and you jump in your car and drive to the grocery store.
In other words, you gotta be homebound.
Right, you've got to be homebound. So they'll come in and they'll do physical therapy, nursing, occupational therapy, speech therapy, depending on what your diagnosis was. And you'll also have an aide maybe for a couple of hours here and there during the week to help you with your activities of daily living, which the acronym is ADLs, which is toiletering, showering, bathing, and dressing, getting dressed. So that's what ADLs
Do you need
are.
someone at home at all times? 24 hours, or you need help, like a spouse or?
No, you
So
can be
then-
by yourself.
Oh,
You can
okay.
be singular and be by yourself, and they'll come in, and they usually come in a couple times a week, and that's paid for by insurances. And that could last, if it's a broken hip, it could last 3 weeks of physical therapy, and then you could graduate from that to an outpatient center for physical therapy.
Oh,
So,
okay.
but insurance does cover that. The other factor is the private sector. So, which today there were 18 private home care agencies. There's probably about 400 something throughout the state, and then another like 375 Medicare certified home care agencies. So, it's a growing part of the industry.
This is good, though. I don't think you heal well in a hospital.
Mm-hmm.
You heal much better at home in your own environment. That's where you really want to be.
Right, absolutely. So in the private sector, like Accessible that I represent, we come in and we can do a medical model. So there's medical model, private sectors, and there's non-medical. So non-medical, they would come in and help you with your laundry, help you with maybe meal preparation,
Right.
running errands for you, going to the store, what have you, maybe occasionally helping you with your activities of daily living. The medical model can come in, and we have nurses on staff, and they can come in and do wound care, they can do IVs, they can do insulin injections for diabetics, so a multitude of things. Again, it's private funds, so you pay, it's not covered by insurance.
Oh, okay, so you pay yourself.
Right, and there are some people who maybe they're aging in place and they're at home, and maybe when they were in their 50s or 40s, they bought long-term care insurance, which
Yes.
we've all heard, and they've been paying their premiums, depending on what type of insurance. There's probably about 5 left in the country that do long-term care. That will cover a percentage of home care, covers a percentage of assisted living, sometimes hospital, depending on what you bought for, a product at that time.
Right.
So, and you've been paying your premiums over, 20 years or whatever.
So you
So,
can't go and buy home care when you're in your 70s.
long-term care insurance, you can't, I think
Long-term.
there's an age limit, I'm not quite sure on
Yeah,
that,
'cause
but.
the insurance company wants to make some money before they
Right,
start
when you're
paying
young
out.
and healthy and what
Yeah,
have
before
you.
you
So
start paying
there
out.
used to be maybe 20 in the country. Now it's down to five companies left in
Because
the
it's not
country.
paying.
Exactly, yeah, unfortunately.
Yeah,
So,
the insurance companies aren't making money at it, so
Right.
they're not gonna
Right,
do it.
yeah.
I mean,
right. So sometimes long-term care insurance will pay for the private sector. Also with private home care agencies, we contract with the veterans, so the VA.
ah,
So we can help not only the veteran, but the veteran's spouse also, which is
Yeah.
called an aid and attendance program. And it's
Ah.
based on your finances, and if you, served during a wartime and that you were honorably discharged, there's a whole huge criteria
Right.
that has to be met, but, for aid and attendance program. And again, that's another funding that will help with private home care.
Oh,
So there's a couple options there. And again, people like to stay at home. Sometimes that's not available and you have other options that we're gonna discuss today. But,
Right.
Again, it's the Medicare certified. You need a physician's referral to get that, and it's usually the VNA that will do all that legwork for you. They'll come to your home or wherever you're living at the time, and they will do, again, nursing, PT, OT, speech. And then private sector, you pay privately, and we come in and we do aids, we have CNAs, we do home care, companion care, and certified nursing assistants, as well as RNs on our staff. And we'll come in and help you with your activities of daily living. We can do live-ins, which means that someone would actually come and live at your house, and aid would move into your house.
oh, that's
And they
say,
would,
yeah, that-
and they would be there and take care of you and, do everything from meal preparation to light housekeeping, light laundry, transporting you maybe to physician follow-up appointments that you may have, or, going to the Millbury Mall. So,
Right, I was gonna say, in some cases you might need a live-in. Because
absolutely,
if you need to be toileted,
right,
you don't know when you have to go.
right.
If no one's there all the time,
So the live-in person really becomes part of the family, which is
Yeah.
nice. So, and that might, it might not be forever. It could be temporary because you might get, as you progress and get back to your baseline before you broke your hip. So
Yeah.
again, they're there for safety sitting, helping you. And, they can also do the exercises with you that need to be
Right.
done after, the physical therapist left or what have you. So there's a lot of options, but I do suggest that people look at a few, go online, look at, their websites, look at what people have rated them as, talk with your friends and family to see who they used. We happen to do at Accessible, we do a national background check for criminals. So, which is nice because being where we're centrally located and having Connecticut, Rhode Island,
Corey check.
Yeah. So, which means if someone was an aide in another state and there was a problem, they can't come work in Massachusetts. It's gonna be red flagged.
Yeah.
So, criminal background check, they call them Corey checks, an acronym
Yes,
of.
because that's important, because the elderly are very
Right.
susceptible to
100%.
things like that.
Absolutely,
How do
absolutely.
you protect yourself if you're laid up?
Right, exactly. So there's a couple options available from a home care perspective. And then we have a PACE program, which is another option that Eileen's gonna talk about what a PACE program is and what PACE actually stands for and
Yeah.
how it works.
Well, why don't we get into that now?
Right. Hi, I'm Eileen Rice. I am I'm an account executive with Summit Elder Care, which is a division of Fallon Health. I have been with Fallon Health for 20-plus years, actually in many different capacities. But Summit Elder Care is a PACE program. And what that is it's a program of all-inclusive care for the elderly. And it's a national model of care, provides adults and their caregivers innovative health care and support. It's a model based on the belief that older adults in chronic care needs are better served living at home in the community whenever possible.
Oh, I agree 100% with
Yeah,
that.
it is. It's a great model of care. Who can join PACE? You would need to be 55 or over. Yep. You live in the PACE, wherever the PACE organization, their service area. You do require it requires a nursing home level of care, which would be assessed by the team. Yep. And then that you're able to live safely in the community with the help of the PACE organization. So,
And you don't spend 24 hours with the patient.
no, not typically. We have a day program at, we have 5 different locations
Oh.
throughout Massachusetts currently. So at our PACE facilities, we have a day program and then we also have services that are available in the home as well.
On the day program, you supply the transportation or they have to?
Depending,
Patient.
if somebody needs transportation to and from the program, to the day program, or to physician appointments is
Oh, I know,
available.
in town here, we had, with St. Camillus, they had a daycare, but
They did.
they sold,
Right.
Wow.
and the new owners don't do the daycare.
Right, unfortunately, COVID played into the effect of a lot of adult day health organizations closing their doors and not reopening, which was, 4 years ago, March 11th, the world shut down. So the PACE program, they have locations in Worcester, Webster, Leominster.
Lowell, and Springfield.
Oh, okay.
So 5 different locations in
'Cause that
Massachusetts.
can be important, if you take an elderly parent in, which is quite common today, and you work, the husband and wife are working all day, there's no one home, the kids are in school or whatever, or
Right.
maybe grown up,
Yeah,
you really need to have them taken care of during the day, you need a daycare program.
yep.
And you have a medical model
Yeah,
too,
we have a
right?
medical model as well. So we have primary care, it's called, your care team. So each participant has a care team, and the services that are needed for them in particular. So we have primary care physicians, we have nurses, we have dietitians, we have physical therapy, occupational therapy, social workers. So each participant enrolled has a care team that works with them to provide the necessary services.
Oh, that's fantastic.
Right, and when they go to the locations, they get their meals, they get their activities going on, they get their physicians, nursing staff are right on site, which is
Now,
nice.
is that available through Medicare?
So there's different pay, so basically it's on an individual basis. So you would look at everyone's financial
Right.
financial needs are different. So each person would be evaluated based on their needs. There's many different ways PACE is paid for.
Oh, okay, so you might pay yourself.
Or Mass Health, or yeah,
Mass
it
Health,
depends, yeah.
Depending on how you signed up.
Yeah, I
And
think it's,
and what's your financial situation.
Right,
exactly. That's why I think it's so important. So if somebody is interested in the program, to have that conversation, because everybody's financial situation is different.
Right.
Yep. But back to Lynn, the day program, so it is open Monday through Friday, 8 to 5. And at the program, they have a hot lunch, which is served, activities throughout the day.
and they're socializing
Yeah,
too, which
the
is so
social
important with the senior population, especially if they don't have other families working
Or
during the
vehicle,
day.
they could do a little
They're sitting there
exercise.
watching, no offense, but watching TV.
Right, exactly.
Yeah.
And, not really doing any activities that are, helping them with their, any injury that they might have had, or
Right.
mind-wise,
Exactly.
Yes.
also.
So I think the socialization, the social aspect, as well as the medical component as well.
Now, and then you mentioned you got a place in Webster and Worcester. Did that cover the Blackstone Valley?
It does. So then, and then Leominster, Lowell, and Springfield.
Oh, okay. My son's a physician in Lowell.
Oh, really?
and he works for a nursing home, well, an elder care facility.
Oh.
He's in geriatrics.
Oh, okay.
Oh, wow.
So he's a geriatrician.
Yeah,
Yeah.
so I don't know the name of it. It's right in Lowell.
Yep.
That's
I don't know
great.
if it's part of your program.
I don't know.
Maybe.
Yeah, but it is, when you mention that, so our care team, they all specialize in geriatric care, which is wonderful.
He worked for Fallon
Oh,
a
wow.
while back.
Same last name, Harry?
Yes,
Yeah,
same last
oh, okay.
name, yeah.
For Reliant, for,
No, what was it? The one you had on Grafton Street, they closed.
That was the PACE program.
yeah,
Yeah.
Yeah, he worked there, but then he went to work for, he works for a better deal. He got a job with David Wakefield
Oh, yeah, okay.
in Gardner. He ran the Winchendon facility.
Oh, okay, sure. I've been
But
out
then he
there.
got an offer from this place, and each time they offered to help pay his education costs,
that's great.
which was high,
Yeah.
which I also helped in. That's why I'm still working.
I was gonna
There
say,
you
you
go.
said you retired at 52.
Yeah.
How'd you do that with a son in medical school?
I got an early retirement, then I went and got another job. And I've had 3 jobs since.
Okay.
I work for the radio station,
That's right.
which is the best one yet, because I put the hours when I feel like it.
Yeah.
So,
But, yeah, he worked hard at it, you know, took a lot of years.
yeah. And geriatricians, they're very hard to find.
They are.
For the senior
Absolutely.
population
Yeah.
out there, even though we're lucky where we live. We have some of the best hospitals. We have so many different healthcare provider groups out there, physician-wise. But it's very hard, you know, physicians now getting out of med school, they want to specialize in plastics. They want to specialize in this and that, where
Yeah.
the income is, right? Versus a geriatrician or, you know, a primary care physician. Those are very hard to find these days also,
Yes,
unfortunately.
yeah, I know. Primary care is almost non-existent
Right.
for primary.
It's very
Right.
difficult.
Right, they're booking out months in advance if you've, you know, changed insurances and need to
Right.
have an annual physical. I switched insurances recently and I had to book it maybe 4 months in advance to just meet with the physician and have an annual physical.
Yeah, well, my physician quit. Well, he retired.
Because of you? No, kidding.
He retired. My physician retired. He had a stroke and he retired.
Oh,
So I got another one, and he was great, and I liked him.
You
But then he went out on disability, temporary disability.
mm-hmm. Yeah, it's hard, it's very
Yeah,
hard.
so
And-
now I have a nurse practitioner,
Mhm.
which seems they do a good job,
Right.
but it's not a position.
Right.
But they can't find anyone.
I know.
Yeah.
It's very hard. It's very hard. So what's nice at the PACE program, they do have physicians that work for
Yeah.
just the PACE
It
program.
is, so
And
with the
maybe your
model
son
of,
does in Lowell, who knows?
yeah, exactly. So, yeah, with the PACE model of care, you do have your primary care physician is the primary care physician that's associated with the site. And they do have, they're able to have smaller panels of
Right.
patients, so,
And you like to have the same physician all the time, because he knows you,
Right.
he knows your situation.
right? Yep.
You know, when you see someone different all the time, they're looking at a chart.
Mm-hmm. Right, and everything's electronic now, so,
Yeah.
you know, if they're part of the UMass or the St. Bees, which are 2 major hospitals in this area, everything is electronic, so if they go in,
Yes.
you walk in for the first time, you don't have to go, you know, this is all, they have all your information already, they have your med list, they have this, they have your history.
Oh, I know, it's unbelievable. I mean, I'm with the Milford
Mm-hmm,
Hospital, but now that's part of
UMass
Brigham
gonna
and
be,
Women's.
and UMass now,
And, yeah, UMass now is right.
right, they
Yeah.
purchased, they
And-
merged together.
Yeah, as well as Mass General.
Mm-hmm,
But we communicate electronically.
right,
Yeah.
right.
Yeah.
They just send me a message. I have.
Like in your portal, right,
Yeah.
yeah,
Yeah,
Right.
so,
Which is convenient.
right.
yeah.
But again, where we geographically live, we are so lucky that we're not in the Midwest and driving 4 hours to get to the
Exactly,
nearest
you don't- yeah,
hospital, a level 1 hospital, which we have, you know,
We
multiple
get
in
them
this
all
area.
over.
Right, absolutely.
We're all within driving distance,
Mm-hmm.
you know, just a couple of, half hour is better.
And I think all of us too have been in the industry for quite some time, and we really stress, and we all have aging parents, as well as we're aging, but we really stress to be advocates for your loved ones, because it's a very overwhelming system, and they can get lost in that system.
Yes.
So we really try to help, and I know Kelly, who is the director over at the Northbridge Senior Center, the senior centers are really good. They have outreach people. Usually every dedicated senior center has an outreach director, and they're
Yes.
very, very helpful in helping you, maneuver. As we use this title, Navigating the Healthcare Highway, what are our options? So we're here to tell you what options you have out there and to be advocates for your family. And, say if they're at the hospital and they say, we want to send them to the ABC Nursing Center. You can say, it's always based on insurance and bed availability at this point in time. But to say, I want to go to the XYZ Nursing Center because my niece is a nurse there, I feel comfortable there. So you have options.
Right.
But you have to be advocates and speak up and say, no, that's not what I want for my loved one.
Right.
So we do push that, all of us, so.
And what's unique about the PACE program, if someone is admitted to the hospital, that team, your care team, is monitoring you throughout
Right.
that
It-
stay.
It goes with you.
Exactly,
Yeah.
and whether it be a transition, if you are admitted to a rehab facility, they're following you throughout that, so, which is really
Yes.
nice.
Important. Another option that's out there too, that's been around, how many years now would you say assisted living really in this marketplace has exploded, but maybe like 30 years ago
30
it
years.
started?
30
Maybe,
years, yeah. Wow. Absolutely.
So Melissa represents the assisted living part of this Navigating the Healthcare Highway
Right.
professionals.
So my name is Melissa Barato, and I work for LCB's community, the residents at Orchard Grove. We're located in Shrewsbury, Massachusetts. We're about 6 years old. LCB, the parent company, has been around for about 30 years. We offer independent, assisted, and the continuum of memory care. So I've heard a lot of talk about people want to stay at home. That's where they heal better. Sometimes staying at home isn't an option.
Right.
Family is not close by. It's not the safest environment. Or the most intangible thing is that we're isolated. We've stopped driving. We don't have that group of friends that we had once before. We're lonely. So a lot of people come to look at communities such as ours. Yes, we can help you with care. We can help you with, maybe help with showers, dressings, medications. But the intangible things that we can offer to you is a community of friends and neighbors where you have people around you, where there are options for things to do. What we find often is that seniors stay at home for a long time on their own. Their world that was once like this now becomes like this. So
Yeah.
communities like ours help to expand their world again and give them options. I always like to dispel the notion that you have to give something up to come live in a community like mine. And that's probably the total opposite. If anything, we're giving you things back. We're giving you the independence to make choices back. We're giving you engagements, being able to go to plays, to movies again, to go to the grocery store on your own, to manage, what you need for care, and to not have to worry about those things that are becoming harder to manage, such as shoveling the walkways, mowing the lawn, paying
Bringing the garbage out.
taxes, right, stacking wood for, as we were talking about. So we want to take away the things that are becoming harder to manage and give you an easier lifestyle. And it's more like hotel living, and we have choices. So we have a beautiful restaurant that's open from 7 a.m. to 7 p.m. Nobody's going to tell you have to have meals at a certain time. It's your choice to decide what you want to eat, what time you want to eat it at, if you want to have a meal at all first thing in the
You
morning.
can order off a menu.
You can
Yeah,
order
food
right
is
off a menu.
fabulous.
Yeah.
So just
Can
like when you
attest
go
to
out
that.
to a meal, there's always specials. But then we have an always available menu from fillets and shrimp and salmon to chef specialties of shrimp scampi and chicken pesto and fresh salads and breakfast all day. So it's really personalized.
You have
for a
different
resident.
levels of assisted living, right?
We do. I would say in my community, the majority of my residents come to me independent. They really need very little from me, maybe some reminders from medications. But they want to have friends again. They want to have different options of things to do. But as they age in place, we can provide such things as if you start to maybe want somebody in the room for showers, just to make sure you're in and out safely.
Right.
Or you've had a fall and you need some help with, getting your shoes on or, getting that cardigan around your shoulder. We can provide that. We have the full range from, very easy support to going all the way up to full support for your daily living as well.
I'm familiar, my wife worked at Eddie Pond
Oh, yeah,
for a
very
number of
good.
years.
Yep.
I'm somewhat familiar.
Is your wife's name Linda?
Yeah.
Yeah,
You
okay.
knew her then.
Yeah, I did know Linda. Yes, I did.
Okay.
So we are we are a senior living community. And I always like to say that. Residents that come to me, they are independent, right? And
Yeah.
everybody wants to feel their independence. But where you need some support, we can help you so you can remain to keep that independent lifestyle and the quality of your life remains consistently good. We have poker clubs, we have people that play cribbage, we have cocktail hour every day at 3:00. We have big events that go on. On the 13th, we all do our burgers and brews. That's in June. We just had a wine tasting. So there's a variety of things going on that you probably wouldn't be having if you were at home by yourself.
Now, do you accept couples?
Yes, absolutely. So we do have
Yes,
couples there right
Yes,
now.
This can be a way of still staying together.
100%. So, and the nice thing is, you may both have different care levels, care needs. One may need nothing from me, one may be experiencing some memory loss, but together we can help support you so you can stay together
In the
as a
same
couple
apartment.
in the same apartment. Absolutely. We have studios, 1 bedrooms, beautiful 2 bedrooms. The community consists of 81 apartments in total. With beautiful outdoor grounds, walking paths. We have a wonderful team from every day. We have something going on. We usually have 8 to 11 activities during the day. But if you have your car there and you can come and go as you please. You want to go to the Cape for the weekend, that's fine. You're going to Florida for 2 weeks, that's fine. It's not about stopping the way you've always lived your life. It's just making sure that it's well supported, that you have friends, you have neighbors, and that, you have lots of different options.
And that's all private pay though, right?
We are all private pay. So, yes, it's all private pay. So whether you have long-term care insurance, which helps to sustain that stay with us, or you have investments, you've sold your house, or you have pensions or Social Security coming in, it is all private.
Oh, if someone has a good pension, then they might be able to afford it.
100%, 100%. And sometimes when people sell their home, they
Right.
use the home to
Yeah,
help stay.
Yeah, you just liquidate that money
Right.
down.
And what we find is that, the generation of where I'm going to save all of my money because I want to give it to my kids, that's gone. Because, we stay at home and then if something happens and you can't stay in assisted living, those funds are going to pay for whether it be a nursing home, private pay, that's what they're used
Home care,
for.
oh, no.
Home care,
Yeah.
absolutely.
Melissa, on some of the assisted livings, there are how many in the state of Massachusetts now? It's
Oh, I'm not sure
Yeah,
exactly
it's
of the number.
hundreds
So,
at this point in
hundreds
time.
at this
Well, I know they're
point.
building them all the
Oh my
time.
gosh.
They are.
Really
They
expensive.
are.
And there are some, right, can you explain, there's some that you have to do a buy-in?
Correct.
And
So,
then some are just month-to-month
right.
rental?
When you start looking at, let's say you're looking for the next step. There are different types of communities. You have CCRCs, which are continuing retirement communities, where you have a buy-in. So you actually buy the apartment. But they are independent living. And they can only offer a certain amount of care. And most of the time, they don't have memory cares, that continuum attached to them. They will have a nursing home attached to them, long-term care that we're going to talk about in a little bit. You also have totally independent communities where you start on independent, but when you need some assistance, you need to move to another side of the community. We are a little different than that, where you come into us totally independent, and when you need support, you stay right in the apartment that you've made your home. So there's not transitioning from one to the other. And if memory care is ever needed, it's right in the same building. So you can start again, and you can stay right there, right till the end of
Good thing
life.
is, when you purchase like that, you actually can build equity, right?
Somewhat, because you
Not
get
a
a
lot, but it's something, I mean. when
you get a portion of what you've bought into it,
Right.
but not all of it back.
Right.
So it's a little bit different, so.
And you're a rental, so you.
We're rental, so we're
Right.
30 days. So if things change, or let's say your kids move out of state and you want to be closer to them, it's simply a 30-day notice.
Yeah, you're
And
not
then
stuck with having to sell this.
you're not stuck with having to sell the
Right.
apartment, that's for sure. And care changes and care needs can change on a dime.
Oh,
You know,
Absolutely.
I say it's all good till it's not, and it can be not good quickly. So we give you that ability to kind of ebb and flow, you know, as needs change, for sure. But it's definitely worth the visit. If you, and I always say, don't wait till you need it. You know, you
Right.
want to start exploring your options now when you don't need it. You know, go in for a visit, have a meal, go to something that they have, you know, that they're sponsoring, and stop by. That way you have in the back of your mind, this is my 1, 2, and my third option. Because when we wait until something happens and we need it
It's a panic
tomorrow,
situation.
often your better communities have wait lists. So
Yeah.
you want to know
Yes.
what that looks like. So they always say, you know, no time is as good as the present, right? So there's no reason to not explore it right now. So, and without that pressure, you can make an educated decision on what your next steps will look like.
And I think you brought up one time too, which was nice, and we've done this a few times at the different senior centers, but I always think it's good that you say, choose 3, go and visit 3, don't
100%.
overwhelm yourself.
Right.
you
Right.
know?
So when we see families, and I'll get the call, we're going to see 8 communities, okay? So I want you to envision when you call somebody on the phone, and you tell them your story, and then they say, oh, let me transfer you. And then you tell your story again. Oh, let me transfer you. So you tell your story again 8 times. By the 8th time, you're just done. So I say pick 3. You want 3 that are close to family. You want 3 that are
Right.
close to, you know, people that are going to come see you, and go see those 3. You know, you want to look at the people that live there, see the team that's in place. And most importantly, when you walk out of a community, you should say, I could see myself living there. I
Yes.
would have a great life. That is really important. So pick 3 when you begin to start searching for that. Super important.
And a lot of times too, I know my company will go in and do additional help
Yes.
for the residents who reside there that might need additional home care.
Yep.
So we can go in.
Yep, we
and
had a
help.
resident that was going to a wedding, and the whole family was
Right.
going, but he needed some support away, so it was nice to have Lynn come over, and her team provided some companionship during
Right,
the
they
wedding.
went to the wedding and drove him and went to the wedding and made sure he got back safe and sound.
Absolutely, yeah.
Oh,
So,
wow.
yeah, and the
Yeah.
family, so from that point of view too, they might need additional help if they're in the memory unit or what have you.
Absolutely, absolutely. And we've had Patty's team over when people are, you know, at the end of life, or not even the end of life, because hospice has such a bad rap. I think that it's the end of life. We have people that go on hospice and they graduate. So it's a nice network of people that we do work with.
You
We
know,
have a
I
nice
think the point
camaraderie.
is, what we were all saying, that's their home. It is, yes, it's
Yes.
Orchard Grove, but it's like,
Right.
that's their
Their home,
apartment,
that's
that's
their
their home.
address.
So the services that you might need, you're thinking in your home, that's the private pay, even the
Right.
skilled,
Right.
even the hospice, whatever that is, so.
Yeah,
And there are some of the assisted livings too, they can go to the PACE program.
absolutely. In fact, I
Yeah.
just spoke with somebody about that today. And it is your home. I mean, Orchard Grove does become your home.
Right.
It's an easier way of living. We always say it's a cruise ship on land.
It
So,
is. It is.
you know,
It's a fun atmosphere.
it is.
And I represent also Shrewsbury Nursing Center, which is a nursing and rehab, skilled nursing center or nursing home, whatever terminology you'd like to use these days. But our physical therapy group, we just went over and did a presentation, and we might have had 20 people from
Yeah.
residents
Yeah.
there, and we were talking with them and educating them. And it's just a great atmosphere.
It is.
It really is.
You know, it's to dispel the notion, you know, when I see my seniors come in, they think, oh, my family's looking at the home, where there's no choices, there's no options, it's a loss of independence. It is a total 180 of that. If any, we're giving everything back to our senior that has really lost that independence by being in their house because of whether it's, you know, physical ailments or not driving or lack of socialization. These are all the things that communities like mine give back to our seniors.
So another option for people are assisted livings, and again, there's large groups building on every corner these days, but
Yeah.
be selective, do your homework.
Yes.
You know, Mr. Google can give you a lot of
Right?
information.
But go in.
Yeah.
Go in and see the residents that
Yeah,
live there.
physically going in.
Physically going in.
Yeah.
And
Have
most
a
of you
meal.
can do your virtual tour too, but you really
Absolutely.
physically want to go.
When you're
see what
physically
it's
there,
about.
there's a.
You get the
There's a feeling.
Right.
Yeah,
And you get to see the staff.
you do. You
And
do.
interaction and,
Yeah.
yeah.
But it is that feeling. I wish I had a bottle,
Mm-hmm.
and I had a bottle that every time somebody came in, I could say, "Here's your bottle. Take that home,
Mm-hmm.
and open it up." Because it's that feeling that makes you say, "Yes, I could
Mm-hmm.
see myself here."
Right.
Yeah, I think memory care is becoming a very big factor.
It is.
because We're living longer
We are.
and we're seeing more people
With
develop a
Alzheimer's,
problem.
right.
Yes. So we do have we have 21 apartments in our memory care. I do say that they are apartments. Every resident has their own apartment, private bathroom, little kitchenette. And so it's just a more supportive community. Dementia, memory loss, Alzheimer's, it doesn't define who we are. It's just a different way of living. We're proud to offer a one campus philosophy where even though I have residents that do have cognitive impairment, they still enjoy a lot of the things that are going on in my traditional senior living
Right.
side, from exercise classes to cocktail hour to musical entertainment to the bigger engagements that we have, to choirs, to mass that we have going on. So we really do combine both. But on a day-to-day, for such things as meals, where a large restaurant atmosphere is too much, we offer a smaller dining atmosphere that allows those that are suffering from Alzheimer's or dementia that are living with that can be successful in ordering their meals versus a 20-page menu that
Right.
becomes a little bit overwhelming for them, for sure.
Yeah,
And then the next option from going from assisted living is looking at a nursing center.
Correct.
So if you're in the memory unit over at assisted living and as your disease progresses and you need more care, then we look at options of nursing homes. I also consult for Shrewsbury Nursing Home that's still family owned and it's been in existence for over 50 years on Julio Drive in Shrewsbury. And at one time there was a nursing home on every corner, right? And now there's less than 400 nursing homes in the state.
yes.
And we happen to focus on short-term. So short-term means for people who are watching this program, short-term would be, again, you fell on the ice, you broke your hip, you went to the hospital, you had surgery, they said, we don't want to send you home yet, we want to send you to a nursing rehab for maybe 2 or 3 weeks. That's going to be paid for by your insurance.
But that's part of the insurance. They don't, insurances want to pay to be in the have you in a hospital.
Right.
Correct.
And
And you
The
get
hospitals want
discharged.
you out.
Yeah,
Right.
they
They
need
want
those
They
you
don't
out.
have the
Insurance doesn't
beds,
wanna
they want
pay.
you out, right? I think I heard something yesterday, or the
Yeah.
day before, there's only, like, out of all the hospitals in this area now, about 400 beds that are open right now.
Oh, I
Out of all the
believe that.
hospitals, so less
Me
than
too.
that, yeah. So
Yeah,
you go
you're
to a
moving
nursing
into
center.
in a nursing home situation where you can rehab there.
Right,
Correct.
because there's, every nursing home has their own PTOT, speech,
Right.
nursing. So when you go into a nursing home, let's say you're only going there for 2.5 weeks, and your Medicare is you have to have 3 midnight stays at a hospital in order for Medicare to pay for your nursing home care. So there's a term called observation or admitted. 2 different words, 2 different factors. If you're under observation at the hospital, and you're on a gurney, and you've been there for 3 midnights, but you've never been admitted, even though you think you've been in a room and you're on a gurney and you got an IV in you, but they haven't admitted you, Medicare is not going to pay for your stay at a nursing center. So you have to make sure that you are admitted and have 3
Yeah,
midnight
look,
stays.
no, really, that's getting to be common.
Very much so.
Very much
So again,
so.
advocate, and as long as you're admitted, you can then go into a nursing center and Medicare will pay. So Medicare pays for the days of 0 to 20 at 100%. After day 21 to 100, there is a copay charge if you don't have a secondary insurance. So, and that's usually a couple $100 a day.
Right.
So, again, make sure you have the 3 midnight stays when you're in a nursing center. And you going into nursing homes, again, we use the suggestion. If you have aging loved ones and there's disease involved or what have you, really go out and tour. Pick 3, as we said. Go out and tour. And based on, you can Google and go on massgov.com and you look and see at the ratings
Well,
of a
isn't the
nursing home.
situation, a lot of times, the doctor recommends the nursing home they're gonna send you to?
No.
Oh, okay.
They may,
You would
they
hope
may
so.
recommend you to a rehab.
Yeah,
Based upon the beds, but
It's
like Lynn was
usually a
saying,
case
you have the
manager.
choice
Yeah.
to say no.
right.
I was gonna
And
say
it's
the case
usually-
manager at
You
the
can
case
pick the one you wanna
manager.
go to.
It's not the hospitalist at the nurse, at the hospital, your physicians, it's hospitalists that do the rounds. It's really the case managers at the hospital that say, okay, these are the 3 options, these are who has a bed available, who takes your insurance, blah, 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 all those have to be in place. And, when you go, again, look, there's a rating system. And so you want to go on mass.gov, and the rating system is a star, 1 star to 5 stars. 5-star is the best. Shrewsbury Nursing Center happens to be a 5-star facility, so that's the top level that you can get. It's like the gold seal. So you can, when you're looking again, touring, you want to ask them, what's your latest survey? I want to look at your survey results. Don't go in and look, oh, they've got a great chandelier, but they don't have any staff.
Right, yeah.
They have great carpeting, but they don't have any staff. Or they have I tell the story one time. I've been in this industry a long time, and this gentleman came in and he was so happy, and he's like, oh, this nursing home I'm choosing for my loved one, they have a 1-star rating. And I looked at him, I said, 5 stars the best, 1 star's the worst. So you want to look at that. But again, go to Google. You can find out a lot of information. Go and do a tour. Again, don't wait until a situation occurs and all of a sudden your loved one falls, breaks their hip, they're in the hospital, and the hospital says, they're being discharged tomorrow on Friday. What are your plans?
Yeah,
And you're like, we all get those frantic calls, and people are like, oh my God.
Never busier than a Friday afternoon.
Oh my God, yes, I used to hate Friday afternoons. So again, people are in panic mode and they have to make decisions, so plan ahead.
Yeah, well, in
You
a
know.
lot of cases too, you may not be able to get into the one you want to get into. 'cause
Exactly,
they're
there's
full.
no bed availability or that insurance isn't taken, so you have to
Right.
find out what insurance they have. And tour, and again, you look at the interaction of the staff to the clients to the residents, you look at the family's involvement, look at all that, don't look at just the chandelier,
Can you actually do something without looking around before you really need? I'm talking
Absolutely.
No needs at all.
Absolutely.
Absolutely.
Have them on your hit list,
I have people
Yeah.
come in all the time for me that they're looking
Mm-hmm.
for the future.
Right. Plan
And they
ahead.
just want to plan ahead and just, they're looking out for
Yeah.
years down the road.
Yeah,
And
better do that than be under the pressure of, oh my
100%.
God, I gotta do
Right.
something within the next day or
Right.
two.
And
100%.
especially someone with Alzheimer's, we were talking about memory impairment and Alzheimer's or dementia, leading up to Alzheimer's. The average person that's diagnosed with Alzheimer's from diagnosis to death is 20 years, believe it or
Yes.
not.
Oh,
That's
I
a
believe
long
it,
20
yeah.
years. So people specialize in memory units. So at Shrewsbury, we have a secured memory unit. There's always a wait list. And the only time that wait list, an opening happens, is if someone unfortunately passes. But
Yeah.
again, we can also accommodate that patient into our integrate them into our regular nursing center and have them on the list. So when a bed availability becomes aware, and that ratio is different of staffing, activities, colors, everything, noise, everything is so different in a secured memory unit. So again, if you're planning on that and you have a loved one who is diagnosed, go and put your name on a list, because those lists don't
Yeah.
open very often for memory units.
Yep.
Right.
And short term, again, you could be in and out. You could go and we had your hip, you get your physical therapy, you get all your nursing, all your meds, everything. You then are discharged home. So again, there are numerous nursing centers throughout the state, not as many as they used to be. A lot of them, there's only probably 5 in this area now. They're still family owned. A lot of them are owned, but large corporations own them. So again, do your homework. That's what we recommend, and see what their specialty is. At Shrewsbury, we have an outpatient center also, so we can do, if you're at the nursing center and you get discharged, do you have the same staff for physical therapy, occupational speech, going to the outpatient
I
center?
think that's important with someone under memory care because you get used to certain people.
Right, right. And then
Yes.
usually memory, they're not usually getting skilled services, so.
Right.
And then we work with many, many hospice companies, so I'm gonna now, have this over for hospice. But before we close, I just wanna say Shrewsbury's located at 40 Julio Drive. The number's 508-845-6786. And Accessible Home Care, which is a private home care agency in Auburn servicing the Central Mass market. Office number is 508-859-1644.
Okay, we've got about 15 minutes left.
There you
so-
go.
Okay. I'm Patti Thibeault. I represent Notre Dame Healthcare, but specifically within that system, the palliative and hospice programs. We take care of both pediatrics and adult patients on both those programs. Unfortunately, people don't think about the kids, and I know it's different from the subject we're doing today, but I mention it because I think it's important that there are only 2 to 3 hospices in the entire state. It's a big state that will do hospice care for children. And you've got a big hospital like Boston Children's Hospital, and there's not places to send these kids, and so I think it just kind of speaks to the level of nursing and the level of care that we provide, that we're entrusted, and that we've decided to do something that's extremely, extremely difficult. That's why I mentioned that. But our hospice has also a palliative program, but people get it mixed up, and they'll think, they say, oh, I'm on palliative care, but you're actually on hospice. Or, so I think it's important people understand hospice is a very regulated industry. You have to follow the guidelines of CMS, so the Centers for Medicare and Medicaid. We have to be really understanding that there's regulations that have to be met. So, but within that, a hospice can meet the minimum regulation or the max. They can go to the max. There's always a minimum. And so the research, just like we said with every single program, is just understanding that even though they're regulated, they're not equal. So you really want to look into, are they a national company that's got pop-ups everywhere, or are they local? Like Notre Dame, we're a nonprofit. We're right here in Worcester. We are a faith-based organization, but we take care of all denominations, all ethnicities, we are open and diverse, and we definitely think it's important, though, to take the clinical part of hospice, which I'll explain, but also the mind, body, spirit. And that spirit could be anything. Doesn't have to be a religion. But we like to think that, just like Melissa said, the disease doesn't make you the person, right? The person has a disease. But our job is to come in and find out who is the person, who were they in life, who's surrounding them, who's their loved ones, their care team, and then come in and meet the clinical needs, but meet also the psychosocial needs, and then, meet the care needs for the surrounding loved ones, so that they can all sort of go through this journey and not in crisis. That's why the sooner you think about it and at least let hospice into your mind, the sooner you can start to understand that it doesn't mean the last 3 days of life. That, yes, the guideline is 6 months. So typically a doctor will have to say that if things continue down this path, I'm not surprised if this person passes within the next 6 months. And then within that, we have to meet eligibility standards for Medicare or even private insurance to be able to say, yes, we do feel this is the end stage of whatever that disease is. But some people will get all this wonderful attention and all this caregiving, and they stabilize.
Yes.
Graduate.
They can graduate,
Yeah.
They've been on for a really long time, but they're not getting worse. They may not be getting super better, but they're no longer a safety risk. They're no longer in that active state of end of life.
Right.
And then the ones that are, we're there for them to be able to make that journey and at the end live with, for the people that were surrounding this person to know that they provided what they could and that they now don't have guilt. They now had time to process, time to be together or have decisions, time to make decisions, have conversations, important conversations about what are my goals, what are the things, where's my hard stop? Is it once I can no longer eat, call hospital? Like once I get to a place where my life is no longer fulfilling, then we need to think about not going for more and more treatments, more and more doctor appointments, more and more, because it's not helping, it's not working, and it's bringing a quality of life down. So that's why like that 6 months is kind of important. You could still be going to doctor's appointments, right?
Right.
And then you're like, well, I'm not going to make a decision to go to hospice because I'm still able to get to the doctors, but that doesn't mean you're not hospice eligible. That just means you're making a decision to continue to try to get different treatments and things like that. And healthcare is so fragmented that if you have a lot of specialists, you're going to get a lot of different advice.
Yes.
And, I could tell somebody something about the hospice philosophy and, this isn't, every physician out there may say something completely opposite of what I said, because physicians and even nurses, like hospitals, their job is to save you or to fix you.
Right.
So it doesn't come natural to think, well, this treatment's not working, we're going to stop. It's like, no, let's try another one. Let's find an experimental one. Let's do this. So I think it's a very difficult conversation. It's a very difficult decision. But people really need to get out of their mindset that they're signing the death warrant of their loved one. Because the disease is doing what the disease is doing.
Right.
The body is going to react the way the body's going to react. What happens, though, mind, body, spirit, family, entity, is how you travel that path. Because the path, it's before you. You may take it and it goes bumpy, or you may take it goes smooth, or it might go up and down, but it's going to happen. We get in one way, we get out one way, right?
Right.
And it's just having that being aware enough to have the conversation, and then, and I'll go through what our services are, but also every one of us has made the point that making decisions in crisis is never good, but even at a hospital, even if you're told your loved one has to go home on hospice, and you're like, hospice is not 24 hours a day, who's going to take care of them? So you may have to put the brakes on and say, wait, whoa. I either have to find caregivers in my home, or we have to find a bed in a facility. And we can still go as a hospice to the facility, and we can still provide all that surrounding extra layer of care. And what that surrounding layer is people that we're not trying to save lives, we're trying to save lives. So there's two things to that. We're trying to save all the lives of the people that have to walk this journey.
Right.
But we want to make sure, and how we're going to do that is the nurse case manager is going to make sure that all symptoms are being like we're taking care of any kind of pain, any kind of symptom management, that we're ahead of everything. So we're never chasing pain or discomfort. Our social worker is going to make sure if our conversations needed. Do I have to help these people make out like healthcare proxy decisions? Do I want to be resuscitated? Do I want? There's a lot to be
Right.
to kind of have to think
You
about.
don't service just the patient, you service.
The family.
It's the unit,
And
whatever
the
that might look
family.
like, And then we have home health aides that will go in and help you with your personal care. And again, whether you're in a nursing home, an assisted living, or at home, they help with your showers, your ADL. So whether that's feeding, showering, changing the sheets and making sure you are groomed and a gentleman has a good shave, a lady has her nails done. The stuff that gave them pride in life should give them pride even if they're not on their way to their job. They're in a hospital bed, but they deserve to be clean and groomed and fresh sheets. That's like a big deal for us. We also have, conversations because not everyone's on the same page, caregivers. So we're able, and even in a rest home, in a nursing home.
Family dynamics.
In an assisted living, you gotta kind of bring in the professionals, because the professionals are their family. They live in that's their house. We
Right.
need to have relationships with them and discussions to take care of them as a team. And then we have music therapy.
So
We have,
important, especially for Alzheimer's. They can't remember, but you do a song from 20 years ago, they still remember
I
the
just read
words.
an article about that.
Well, it connects in, deeper in, but they don't just play the guitar or the piano or have a nice singing voice. They're actually mostly have master degrees in therapy because they're
Right.
using music. We had a family that bonded around Christmas and they weren't going to make it to Christmas. So we had Christmas in July, and they sang Christmas songs and had a big Christmas party, and he knew every song to every song. It was just laughing, and you would have never known we were in the last 2-3 weeks, but it gave, now they have tape recordings and pictures and memories, and they're going to sit around next Christmas and they're going to cry, but they're going to say, do you remember
Right.
how fun that was?
Yeah.
So it's things like that. So yes, it's the clinical part. We have a medical director. She's actually the head of geriatrics at UMass. So to your point, geriatrics is very important. We have a second medical director who specializes in ALS, do a lot of vent patients. We have bereavement counsel that stays with you for 13 months after the death of a loved one. So every holiday, every first year that I missed this, a year from that, they're there to support you through that journey.
Because everybody's grieving process is
Yes.
different.
Yeah.
Yeah. And we also have spiritual care. And like I said, it doesn't have to be a domination. Like, it can be just about your inner core spirituality. Or you can identify with a religion. And but that's important because a lot of people, they're doing life review. And the human beings aren't simple creatures that live, this one path and, those these, so.
We're getting down to the wire here, but I wanted to, do you offer a service to someone, to a family where they had a loved one that just passed away suddenly?
Yes. Oh, sure.
Yeah,
We actually
connected.
do bereavement out in the community. You don't even have to have been on our services.
Right.
We
Yeah.
go to our partner communities and provide bereavement for their residents, and then out in community centers and
Right, 'cause
churches.
that could be very trying
It's,
on a family.
yes.
They do a fantastic job at our community every other
do.
month with that, because there's so many ways that grief can come about, whether it's the loss of driving, loss of independence, loss of a home, and Notre Dame has been phenomenal with our residents.
We take it so seriously that if you're not addressing the entire person and the whole life they lived, then you're not taking good care of them, and you're not taking good care of all the people that lived their life with them,
Right.
because it's so complicated. We're all so complicated that it takes a team of experts to really help you survive that journey. And it's really important to us.
But it's a journey we're all gonna take.
Right.
Yeah.
Absolutely. We're born and we die.
Yeah.
We
But
really
again-
live in between.
Hospices don't have to meet music and massage therapy. Those are not paid for through reimbursement and insurances. That's because we're a nonprofit. We do that. You could see a nurse once every 14 days. That's totally legitimate. You could see a health aide for once a week. Totally legitimate. You can turn down your social worker. We do 2 to 3 visits minimum, and if you're at home, it's always going to be a lot more. We do daily visits when somebody starts to maybe transition towards the very end. Our aides are there minimum 3 times a week, sometimes 5. We work on the weekends. We're 24/7. We have 3 nurses on every Saturday and Sunday. We do regular visits, so you're not waiting 3 days to see your regular nurse. And then we have somebody just answering the phones to triage people that are calling with either emergencies or questions or what have you. And then we have someone that can run out and do an admission, or if somebody passes, they can go and pronounce. That's unheard of. That's unheard of. We have 4 full-time social workers, which is also unheard of for a census of only 90 people. If you go out there and you really research hospice,
It's very important.
they don't have staffs like that really deal with anything more than a check-in.
And I think, again, planning, being an advocate, and then, don't wait until, your loved one takes their last breath.
And you have choices.
Right.
Yeah.
Right. Again,
Yeah.
listen
I
to
want to
us.
thank you all.
Thank you
for
so
for
much.
coming
We
in.
appreciate
Very
it.
interesting. And hopefully people will get something out of this.
Great. Can we quickly just say our
Very quickly.
organizations again? Shrewsbury Nursing and Rehab and Shrewsbury, and Accessible Home Care in Auburn.
Eileen Rice, Summit Elder Care, and
Melissa Barato, the residents at Orchard Grove.
Patti Thibeault, Notre Dame Hospice. You can also find us at Notre Dame Healthcare, that's one word, .org.
Right, well, thank you very much
Thank
for
you.
coming
We
in.
appreciate it.
Thank you.
Thank
thank you so
Thanks
much.
for having us.
And we'll see you next week on About the Valley.